in therapy. And one of my first clients actually pointed me toward what a lot of my life work and research has been about, which is conversion therapy, or what we used to call conversion therapy, because it's not really therapy. It's sexual orientation change efforts. When I saw this guy, he was about my age, or a little younger, I suppose, late 20s, who had, and to look at this guy, you would think, wow, he had worked as a model, he was fit, he was well off financially, seemed to have every advantage. However, when he was in college at BYU, he came out to his counselor as gay. And the counselor said, I need to send you to Dr. So-and-so in downtown Salt Lake City for some therapy. So he went to see Dr. So-and-so, who said, yes, I understand, we deal with this problem routinely of homosexual attractions. I want you to go down to, he named an adult bookstore, and said, I want you to go pick out some gay magazines or, that you find particularly arousing and bring them back to me. I thought, okay. So he brought them back, said, show me which pictures you really like. And the doctor made slides out of them. And so he hooked up this patient to a chair and attached electrodes to his hands and to his genitals, and would present the slide on the screen of the homoerotic material that this person had picked out, and would deliver an electric shock.
Wow.
Upon the cessation of the shock, I mean, not enough to kill him, obviously, but certainly enough to be painful, would present pictures of Playboy centerfolds. This was called Playboy therapy. And it was intended to, on a, if you will, visceral or cellular level, extinguish one's innate and natural same-sex attractions and replace it with the Playboy bunny. You can imagine that this is not very successful. But what it does do is get people completely messed up, again, on a cellular level, about their own sexual orientation.
Yeah.
This fellow, I'll call him David, came to me absolutely suicidal because he said, it didn't work for me. And I was excommunicated from the church, which also meant being excommunicated from the family, the culture. I came out here to the West Coast to live, trying to leave it all behind, but I couldn't leave it all behind because it's all I've ever known. And now I'm depressed, I'm suicidal, I feel worse than ever about being gay. I am sexually dysfunctional, which, you might imagine. And I want to kill myself. That was one of my first patients. And it underscored to me the importance of, all right, you've got not just a job here with him, and it was difficult with him for a long time, but you've got a job here for the community and for our culture. These practices are tantamount to torture. They are.
They are torture, yeah.
They are torture. And the more I dug into it, and when I first started working in that area and publishing my own research, there were people who would say, you must have been through conversion therapy yourself. I said, hell no, I never even heard of it. I mean, let's face it, I didn't grow up in like a gay paradise, but there was nothing that I'd ever heard of around the Bay Area where people were doing this. But as it turned out, it was not uncommon that this sort of thing would happen. And I learned there was a whole history of this sort of thing. And it wasn't just electric shock, but the administration of nausea-inducing drugs. So that as you're looking at your, favorite, male nude or whatever it is, you're given a drug that makes you vomit. When you're done vomiting, then you get to see Miss January again, or whatever it is. And so to this day, I work in that area. I'm really, really proud of the fact that I was able to work with then State Senator Ted Lieu from Los Angeles on the very first bill in the country to prohibit licensed mental health practitioners from engaging in these practices right here in California in 2012. And since then, 20 other jurisdictions have followed suit. And there's a lobbying effort to get all the states on board, because the more we learn about these practices, and believe me, the people doing the electric shock have sort of gone underground. But pray away the gay, and, here, let me fix you because obviously you had a fucked up relationship with your father and you were too close to your mother, and I will fix that for you. And these ex-gay programs that have, cropped up around the Christian churches, how many of them have gone out of business because their founders have said, forget it, this is fraud. Or those who have been put out of business because they themselves, unable to deal with their own same-sex attractions, become sexual predators toward their patients. It's all there. So that has, and actually that has opened me up to what I thought I'd be talking about today instead of my own life and background. The whole notion of how do we use psychological science to inform public policy, and everything from the legislative policies that are enacted to judicial policy, everything about it. How do we understand this as a culture? And why do we